Sure.
Okay, so they're all Allergan products. That's number one. And they're all made of hyaluronic acid, which is a substance that we naturally produce. We're born with it, actually. It's in our eyes, it's in our skin, it's in our joints. And it's one of these sort of substances that gives us almost like a plumping effect. It draws water in and retains it. So, how brilliant to have the products made of hyaluronic acid so that you can actually do that in situ or inside the body. So the way they sort of develop these products is to go into different parts of the face and the skin. So the thicker the product, and if you want to get down to the science about it, it's actually about cohesivity, but we're not gonna talk too much about that. Let's just look at it as thickness, because I think conceptually that's the easiest sort of way to visualize these products. So we can start with the thinnest, which is Volbella. And Volbella is used for fine lines, like around the mouth, in the border of the lip, under the eyes, that kind of thing, because the skin, you want to stay in the top level of the skin, like the epidermis, okay? Or between the epidermis and the dermis. Excuse me. So then we go to Juvederm, which is more for like folds, if you will. And I'm not talking deep folds. You're going to need something a little thicker than that, but like a nasolabial fold, which is the junction between our cheek and our lip. Nasolabial fold, or our marionette lines, which are called marionette lines for obvious reasons. So Juvederm is a great product for that. It's also great for plumping lips. So you put it in the lip proper, not necessarily the border. You certainly can put it in the border for a little turn up of the lip, but oftentimes we use it to augment the lip. Voluma is the thickest of those products, and Voluma goes into things where there's more structural defects or hollowing or atrophy, let's say, of fat. So for example, the most popular place to put Voluma would be right here in the malar mound, which is really the apple of the cheek, if you will. So we see a lot of flattening as we get older in this region because the fat atrophies or dies and the face descends. And so if we put Voluma into this region, we not only can recreate the nice curve of the cheek or the apple of the cheek, but we can also lift the face a little bit. So you can do several syringes of these things and give ourselves what we call a liquid facelift, which is quite nice. I like to often combine all of these products. So I'll do Volbella in the lines around the lips and under the eyes. We'll do Voluma all throughout this region here, and even in the temples where we start to get some hollowing, and also some Juvederm in the folds. So you can really do a liquid facelift with all three of those at one time.